Have you ever gotten a letter from your insurer denying coverage for a test, drug, or other medical treatment? If so, you're hardly alone.
Yeah, 1 in 5 insured adults experienced a denied claim in the past year, and some of those denials can leave you on the hook for costly medical bills. Consumer reporter Cassidy Williams provides insight into medical coverage denials and solutions to help you secure needed treatments.
Come here, let's do the puzzle together.
Toddler Layla Nielsen has a big personality.
Thank you.
But that big personality started out as a 3-pound preemie.
She was a peanut. Definitely a life-changing event to have a NICU baby.
After more than 50 days in the NICU, Layla came home. On doctor's orders, her mom, Kelly, fed Layla a special neonatal formula.
It was scary. It was regimented. I'm a first-time brand new mom, so I'm like, oh my God, what do I just have this peanut of a baby, and I'm gonna follow everything that I'm told to the T.
Neonatal formula isn't cheap, but it can be covered by insurance.
You name it, I kept it.
Nielsen kept all her receipts and submitted a claim to be reimbursed for around $600 worth of formula. But months later, it was denied.
The lady said, you didn't fill out the form right, you missed an NPI, some doctor code number that the pediatrician knew.
NPI stands for National Provider Identifier. It's a unique code that connects a claim with the doctor.
So it can be very complicated to fill out the forms, but what's really important is to try to fill out as much information as possible to avoid getting the claim rejected.
Kathy Holt is Connecticut's acting healthcare advocate. Her office helps people in the state work through insurance denials and appeals for free. It's a resource Nielsen wishes she knew about.
Oh, you're a monster?
Holt says 65% of calls to the Office of the Healthcare Advocate are about denials. 40% are denials for medical necessity. The other 25% are administrative denials, or what she calls connecting the dot cases. Think of filling out a healthcare form like a game of connect the dots. If you miss even one dot along the way, like an NPI number, you could be denied, and the burden is on you to figure out what dot you missed.
The complexity of insurance and the quickness to deny services rather than to fix the problem that may have arisen, the box that wasn't checked, or the signature that wasn't obtained, those sometimes take a little while to uncover.
What do we got? Oh, headphones and music?
Like Layla's matching game,
Headphones and music? Good job. High five.
Kelly Nielsen tried to connect what her forms were missing on her own.
How much time do you think you spent on the phone, sending emails, filling out forms?
At least two days.
But she kept getting denied.
I think in total I was denied 3 or 4 times. And it's like they make you do extra work that's gonna be wrong, that you don't know, so they don't have to pay you and they don't have to give their money away.
When we asked Nielsen's insurance provider, Anthem Blue Cross Blue Shield, to find out what happened, they explained in a statement that the first time the claim was missing the prescription and a diagnosis code, and went on to say, "We understand the back and forth with the member caused confusion and ultimately resulted in no action being taken. We sincerely apologize for that mistake. We have now contacted Layla's provider to obtain the necessary information, and we have approved the claim for the formula."
That's an entire month's worth of groceries. That's a car payment. That's almost more than half of our mortgage. It's our bills. It's everything.
Hey, look, I found the butterfly.
The money is now on its way back to Nielsen. The game of connect the dots finally complete.
Good job, baby.
A denial doesn't mean you should immediately pay out of pocket or skip the care you need. Andrea Gross, CEO and president of MedWise Insurance Advocacy, has worked in the healthcare industry for 35 years. She says while challenging a denial may seem overwhelming, it may be worth it.
You're going to go to your doctors. Even if the first appeal, you get letters from your doctors, you're going to go back to your doctors. Let's say you have to appeal it again. You're going to go back to your doctors and say, okay, I have to appeal it again. Can you please help me with this? And you're going to tell that doctor they have to give you another letter, not the original one that they gave you for the first appeal. You need another letter that's going to be more specific as for the need that you had to be at the hospital.
You can find more information about navigating the appeals process by going to investigatetv.com and typing insurance denials in the search bar.